Good morning, students. Students, do you hear me? Is there any problem? Please just tell me. Students, is there any problem? Do you hear me? Anyhow, I will start the lecture today, which is entitled Candidiasis. Candidiasis, which is the American term. Candidiasis, it's the English or British term. What is candidiasis? Here, from this lecture, we will introduce or display the systemic types of fungal diseases. The previous lectures, if you remember, I talked about the superficial mycosis. Now we'll invade the systemic mycosis. What is candidiasis? Okay, what is candidiasis? Just let us know just few information about candidiasis. Of course, from the name, Candidiasis is caused by the causative agent referred to as Candida species. Candida is the oldest type of fungi discovered at the BC. Later on, we will know the details, okay? Candida considered to be the chief agent.
دكتورة العفو.
نعم يس.
ترى ذاك الرابط الأول ماكو صوت فيعني احنا عمالنا بعش ما بديتي.
ماكو صوت؟ دقائق.
يا ريت تعيدين.
هسه أشيك دقائق. هذا بصوت، اوكي. What about هذا كله هذا هم بصوت. البقى الأخير اي دقيقة، هذا صحيح ما بي just a minute. مشكلة مو بسهولة، رأسي يختفي. ميكروفون. ما أعرف ليش ما يختفي الرأس، متى أسيطر عليه. دقيقة واحدة. المشكلة ليش مدى أسيطر على هذا الباركود اللي جوا البار سوري جوا ما يعني يختفي. اوكي بس اصور ماكو مشكله، الكل دا يسمعون طلاب؟
نعم دكتورة.
اوكي سوري ما كلش عذبني هذا انه طلع. anyhow هسه now we return to say about the candida. Candida considered the chief agent, the chief, it's the queen among the other fungi. Okay, the infection caused by candida, I mean candidiasis, it can be acute or chronic. It have a wide range of symptoms, mild to severe, sometimes superficial to deep. This is definition of candidiasis. What's the meaning of candidiasis? Now, let us also know more details of candidiasis. What is the first discoverer of Candida? Who is the first discoverer of Candida? Hippocrates. You know what's Hippocrates? Hippocrates بالعربي أبو قراط. He is the father of medicine. He is a Greek, he is a Greek clinician. Okay, and the discovering of this in BC, يعني قبل الميلاد, discovering of Candida in BC. طبعا Hippocrates, as I mentioned previously, you should know Hippocrates because he is the father of medicine. He recognized that the persons with oral thrush. What's the meaning of oral thrush? Oral thrush, it's a lesion caused by Candida, referred to as thrush. Later on, of course, we will know in the clinical symptoms and manifestations, we know the meaning of a thrush. In that time, patient developed oral thrush, oral from the name oral, buccal cavity. Due to Candida albicans, of course, Candida consists of many species. One of the most important species, which is also the chief agent among the others, is Candida albicans. Candida albicans. It is the Candida, it's yeast, of course. Put in your mind that Candida is yeast, not mold. Yeast form of fungi. Albicans mean whitish in color, whitish color. Albicans, okay. Therefore, albino, meaning albino, and he is whitish, okay. It's whitish color. Hippocrates said that patients with oral thrush due to Candida albicans were already debilitated by other diseases. What's the meaning of this sentence? That means when the patients develop oral thrush due to Candida, that means he is suffering from other diseases, okay, overlaid diseases. That means Candida superimpose the other diseases. Of course, the details will known later on. There is another clinician. He is Professor Graham Wilson. He is the director of the UK Republic Health Laboratory Service. What he said? He said a nice sentence about Candida. He defined Candida as, it is a much better clinician than we are. And he described Candida as a clinician. How? In its ability, Candida have ability to detect abnormalities earlier in the course of development of such abnormalities than we can all with other or with our chemical tests. That means patients with underlying disease, when he superimposed by Candida, Candida can be considered to be diagnoser, investigator. It's good clinician, can know from Candida, we can know that the patient suffering from other diseases rather than Candida itself. Now, what are the etiology of candidiasis? If you remember, my lecture usually arranged as this type, title, definition. Usually I remember you, okay? Title, definition, then etiological, then symptoms, and treatment, and lab diagnosis. Now, what are the etiological agents of Candida? The major etiological agent responsible of candidiasis, as I mentioned previously, what is? Candida albicans. It is the major species. It's blamed to cause only alone, Candida albicans alone, causing 60% of diseases. Of candidiasis alone, okay? Candida albicans is considered to be a part of normal flora in our body. Therefore, it's considered to be opportunistic. That means it is normal flora. When there is any disease may be caused by the immunosuppressed or whatever, the flourishing of Candida albicans will be occurred, okay? Now, the other species followed by Candida parapsilosis. Parapsilosis is second only to Candida albicans as a causative agent of what? Of endocarditis. Candida albicans is a very dangerous disease, although it is opportunistic, but put in your mind that it's considered to be very dangerous, causing many manifestations, complicated manifestations. Later on, of course, in signs and symptoms, we will know the details of the diseases caused by this agent. The third agent is the third species, Candida tropicalis. It is a major pathogen of disseminated infection in immune-compromised patients. The other species is Candida lipolytica. It's responsible for fungemia. That means presence of fungus in the blood. Candidemia, which is particularly referred to as candidemia. And it's also causes traumatic ocular infection. The other species are Candida krusei, Candida kefir, Candida glabrata, also responsible for many manifestations of Candida. Put in your mind that there are many species, more than 150 or more than this, of species belong the genus Candida. Now, what are the types of candidiasis? When I say candidiasis, that means the disease, of course. We have two types of diseases, superficial and systemic. You remember I said in the first slide, I said we will try to enter now in this lecture systemic, but it's also, Candida responsible for superficial candidiasis. What are these types of superficial candidiasis? It causes infection of skin, hair, and nail, and the mucous membrane. Skin, hair, nail. We mentioned this in the previous lecture. وطبعا حرام ما اعتبرها face to face lecture حتى اسالكم ويصير عندنا فد نوع من communication. Anyhow, maybe يمكن طالب او طالبين حاضرين whoever, but some of you maybe not answer me. Anyhow, superficial, infection of skin, hair, and nail, which is caused by or infected by the dermatophytes. Dermatophytosis means the infection of skin, hair, and nail. Also, Candida have the ability to infect these organs, skin, hair, nail, in addition to the mucous membrane. Now, cutaneous candidiasis, it's a common cause of what is called diaper rash in infants. Diaper, that means pampers, الحفاضات. Diaper rash in infants, which is of course those babies who left for a long period of time with their diapers, of course because of humidity and darkness, and all because this agent, Candida's normal flora maybe flourished due to these bad circumstances, but for us, of course, but it is good for the Candida. Darkness, waste, urine, defecation, whatever. This is a flare up or flourishing the growth of Candida. Okay, the symptoms flare due to diaper rash characterized by what? Developing a moist macular erythematous rash. The rash is moisty macular erythematous. Okay, and the mainly occurred in the gluteal crease, perineum, and inguinal folds. Of course, this area which is exposed to the diaper, to the pampers. This is first. Okay, there is another disease which is look like the diaper rash occurred in infants, but this entity occurred where in elderly patients, which is referred to as interpterygo. Interpterygo, it means comes from, what's the meaning of interpterygo? Interpterygo, it's intertrigenous layers, folded layers. Refer to طبعا احنا قلنا any strange term, that means it is a Latin word, okay, or Latin term. Interpterygotes mean from trigenous layers, folded layers. Where is the folded area? Whatever crease, inguinal area, axilla. Okay, this is mainly occurs in elderly, obese, adults, and particularly those DM patients. Why DM patients? Because those, is characterized by low immune response, and hence this microorganism normal flora, the flourishing of this agent may be occur causing the disease. Also, those patients who are receiving long course of antibiotic. If you remember the first lecture, one of the predisposing factors for fungal diseases, I said the long course of antibiotic which get rid the normal flora, the beneficial bacteria, and hence Candida found as normally it's flourished, and because it's considered to be because antibiotic not kill Candida, because Candida's fungi, antibiotic just act on bacteria. So we get rid bacteria by beneficial, of course, bacteria by antibiotic, flourishing the growth of Candida. Also, this is, this intertrigo occurred mainly in women, in inframammary folds. Inframammary, if you remember, dermatophytosis, Tinea cruris, occurred also inframammary, okay, which it's look like sometimes it's confused I mean, cutaneous interpterygo of Candida confused with tinea cruris. This is, as you see here, this is طلاب اكو شيء بروبلم يعني بس مجرد انسر مي يعني ترى مستمره اني ما اعرف ايش بده يصير هو خلف الكواليس. Okay, continue.
نعم دكتور كمل.
This picture you see, you can see here the diaper rash, okay, of baby. This is diaper rash. This is axillary area. I mean interpterygo of axillary area. Interpterygo because this area interpterygenous, of course, false. Now, another entity of candidiasis, the frequent exposure of hands to water. This may result in what? Candidiasis of hands and fingernails. Onychomycosis. You remember onychomycosis? We take an entity referred to as, you should, if you read it, of course, because you know it was not obliged you to read, of course, because it's open book. Well, I'm against this idea. Anyhow, the onychomycosis, if you remember, tinea inguinum caused by dermatophytes. I said onychomycosis. We can say tinea inguinum or onychomycosis. I said onychomycosis. It's not caused only by tinea. I mean dermatophytes. It's also caused by another agent. One of these agents is Candida, causing onychomycosis, or what is called paronychia. Paronychia, it means the infection of the surrounding tissues of the nail. بارونيكيا طبعا اذا تسالون اهلكم بارونيكيا اهلنا يسموها الاصبع يسموه طالع، هاي بالعامي طبعا انتم ما تعرفوا هالمصطلحات، هو احنا غريبه علينا احنا اللي اكبر منكم، فاهاليتنا يسموه اصبعي طالع، يعني هذا بفد مصطلح عامي. If you face this entity or your maybe you can ask your family parents, those sometimes the surrounding tissue of the nail will be inflamed and pustulated. It's so painful. This is mainly one of the causative agents in Candida, not of course Candida, maybe bacteria causing paronychia, but of course we're interested now with fungal infection, Candida in particular. What are the most important symptoms caused by, onychomycosis and paronychia, characterized with burning sensation, itching, and after dryness, of course, it will be developed scaling. The other entity caused by Candida is the oropharyngeal candidiasis. Here, the thrush. What is the thrush? Oropharyngeal, that means not oral cavity, oropharyngeal. Pharynx also may be developed. Thrush. Thrush, it's occur mainly. Thrush, it means thrush. It's also Latin word. It means white patch. White patch. You remember Candida albicans when I said Candida albicans, it's albino, whitish in color. Therefore, the name comes from this, from albicans, okay? Thrush, it is white patches. White patches mainly occurred, of course, occurred where? In infants, patients with DM, those receiving long-term of antibiotic or AIDS patients. What we can see in the oral cavity, buccal cavity, on the pharynx, inflamed pharynx, we can see white patches covered the oral cavity or buccal cavity, and sometimes occurred in the gums, tonsillar areas, on the tongue also, and even on the palate, hard, soft palate, whatever, okay? We can see these patches, white patches cover this area. This is referred to as oropharyngeal candidiasis. You can see here.
دكتور شنو قصدك شو مصطلح سكيلينج يعني ترى الله حرفيا يعني شنو معناها؟ يعني
ما سمعتك ماما، ما سمعتك شلون؟ شنو؟
سكيلينج يعني شنو معناها؟
يعني تتقشر scales قشور.
تمام.
Okay. Now this is, as you see, this is the white patches, which is cover the epiglottis and soft palate. You can see here tonsillar area, even the tongue, but it's not clear here the tongue, okay, because it's pressed by the clinician finger. You can see here. Okay, this is the oral thrush caused by Candida. طبعا هاي one very important for you. حتى in future inshallah when you will see such entities of patients, you can imagine or know the causative agent if you know it. Okay, now the other entity caused by Candida is angular cheilitis. What's the meaning of angular cheilitis? It is a fissure at the corner of mouth. And this is mainly occurred in accompanies those patients with oropharyngeal thrush. This is mainly occurred in immune-compromised patients or sometimes normal individuals. If you can see sometimes normal patients, immune-competent patients, but he developing fissuring at the corner of mouth. This comes from the accumulation of sputum. And some of patients not maybe interested with their hygienic conditions, okay. طبعا يصير accumulation ولا هي شيء disgusting, okay, but it's an accumulation of sputum in the corner of mouth and he is not clean this area. The accumulation and this microorganism, I mean Candida, presence in the saliva normally, therefore it causes the fissuring of the corner of the mouth. That mean angular colitis occurred in immune-compromised and immune-competent. Immune-competent, those who accumulate their sputum in the corner and of mouth, and those patients immune-compromised who developing oropharyngeal thrush. The other entity of Candida, still we are still in where in the superficial candidiasis. There is a vulvovaginal candidiasis. This is mainly occurred in those patients, I mean those post-pubertal women with DM, whereas after puberty, okay, DM patients may develop vulvovaginal candidiasis, and those who taking long course of antibiotic, and those, I mean pregnant females with in the third trimester of pregnancy. Why in third trimester? لأنه هنا شوية الهرمونal disturbance mainly occurred, or changing flare up of the hormones changing occurred in this trimester of pregnancy. What we can see, I mean the symptoms of vulvovaginal candidiasis, the main characteristic feature of this disease is vaginal discharge. Of course, vaginal, we have different entities of vaginal discharge by different fungus, by different bacteria. But the characteristic feature of vaginal discharge of Candida is curd-like. What's the meaning of curd? It's mean mutajabbin. Curd-like, it is mutajabbin, curd-like discharge with itching, burning, and burning sensation. These are the most important symptoms that the patient develop when he's developing vulvovaginal candidiasis. Okay. Of course, in addition to these symptoms, vulvar erythema and edema can be seen by the clinician when the examination occurred of this area. Now, there is another entity referred to as these are the most important superficial candidiasis, skin, hair, and nail. Now we jump to the, if you remember, I said mucous membrane also may be infected due to Candida. Okay. Chronic mucocutaneous candidiasis. This is an entity, very important entity, occurred in a special entity of individuals who lacking a subset of T helper cells, which is special for Candida. That means those patients suffering from immunological disease. Okay. Those entities of patients may be developing different types of candidiasis, beginning either in infancy, after delivery, or later on in childhood. They developing what? Oral thrush, may be noted after taking usual course of antibiotic, not long course, no, usual course of ordinary course of antibiotic. They developing this disease. Okay. Now, these are different pictures of angular colitis. This is angular colitis. This is oral thrush. This is angular colitis. This is oral thrush. Different pictures. Okay. What are these patients develop? I mean, those patients with mucocutaneous candidiasis, they develop the special entities of patients. They, of course, the thrush may be present in their mouth, may be spread slowly to other parts of the body, not just in the mouth. Maybe go to the skin, nail, hair, esophagus, female vagina, any part of the body may be involved. I mean, those with mucocutaneous candidiasis. Here, skin lesions developed as erythematous macules. Macules يعني big lesions, and small papule, macule, different طبعا هاي terms you will know it in the dermatology. Okay. Papule, nodule, macule, different terms. Macule يعني فت patches شوية كبيرة، شلون واحد يصير عنده allergy حساسية فت بقعة سبوتاية كبيرة. This is the meaning of macule. Erythematous macules with hyperkeratosis and crusting. أيضا تتأشر شلون scaling also. These are the main symptoms that the patients may develop. This disease occurs mainly in patients with inherited autosomal recessive disease. What is the name of the disease? This is long term, which is referred to autoimmune polyendocrinopathy candidiasis ectodermal dystrophy syndrome. Okay, that means endocrinal problem. Therefore, he developed this. Hence, its affect the autoimmune. If you remember, I said it's immunological disease, hence affecting the immune response, and he is susceptible to develop candida by this wide range of symptoms. Now, we turn to still in superficial candidiasis. We have another entity still with superficial. It's ocular candidiasis. When I said candida keratoconjunctivitis, this is keratoconjunctivitis, يعني conjunctiva والkeratitis. That means it is superficial. That means it comes from outside, يعني the microorganism acquired from outside, maybe due to the trauma of the eye, the disease, the causative agent acquired from the extrinsic agent, extrinsic source, causing the symptoms, causing keratoconjunctivitis. It's a complication of why it's developed. How it's developed, keratoconjunctivitis due to candida. It comes from a complication of long-term use of corticosteroid eye drop. Those patients who are taking long course corticosteroid eye drop may develop candida keratoconjunctivitis. What are the symptoms involved or developed in such a case? The patient suffering from conjunctival or conjunctival, yes, erythema and cheesy discharge. You remember in vaginal, I said curd discharge. It's cheesy, متجبن, okay? A conjunctival erythema, conjunctival sac, we can see accumulation of cheesy discharge, and with the progression, we can corneal ulceration may be developed. These are the most important superficial candidiasis. Now, if there is anybody can answer me if there is any question or any something not understood. Nobody here? اوكي
نعم دكتور موجود.
هو يمكن بس انت تحضر. anyhow ما اعرف ابني انت منو انت الممثل لو غير انا ما اعرف منو طبعا لا شايفتكم ولا اعرفكم. منو انت ممثل
لا
لو انت
لا دكتور الممثل احمد سعد.
ها انت منو انت؟
مرتضى محمد اني.
يا اهلا وسهلا اشيدك وانت دائما الحاضر. ما اعرف هو اكو دا يحضرون لو ما عليه يعني طبعا حضروا وما حضروا ما هو
موجودين دكتوره موجودين بصمت.
عندك هذا موجودين.
يعني مو اقول خاف يعني ميبي تحسون بورينج بس هي هاي شغلات يعني مطلوبه منكم. اوكي
دكتوره العفو بس سؤال ممكن بعد المحاضره تنزلين لنا الباوربوينت وياها مو بس الوورد اذا امكن.
بس اسمح لي انا بدي انزله صوره وصوت باوربوينت كامل ليش اعيده بس المحاضره
لا دكتوره مو الملف احنا نشوفه قبل يعني انت تسمع المحاضره هسه ويا حضرتك يعني بعدين على الملف.
انت ما اعرف يمكن حكيت وياي سابقا انا بموقع الكليه منزليه از يعني تكست ويندو على شو اسمه وورد سوري فهو موجود يعني اذا تحبون موجود على موقع الكليه.
على كلاس بس الوورد موجود دكتور.
اي هو الوورد شو اسوي هو الوورد وهذا موجود صوره وصوت بعد شو تريدون من عنده كلش اناف.
وهذا اريده ملف افضل دكتوره ملف هذا هو يعني
ليش حتى يصير التشيتنج سهل بالامتحان؟
لا دكتوره ما احنا ندرس الاثنين افضل بالبدايه على هذا.
ماكو اشكال الله كريم ان شاء الله ان شاء الله اذا ما نسيت الله كريم واذا نسيت اذكروني.
شكرا.
اوكي هلا
ما ادري دكتور. شكرا.
Now we turn to the other type of candidiasis. Now we turn to the systemic candidiasis, which is the deep. Systemic, it means deep, you know. Deep candidiasis, starting with the first organ of the body, which is the first disease which affects the first organ of the body, which considered to be deep, esophagitis, okay? Esophagitis, candidal esophagitis may be completely asymptomatic. This is very important point of view. Put it in your mind, okay? Sometimes it's completely asymptomatic. Or it may cause burning sensation and pain in the substernal area and the epigastric area, or sometimes throats. Okay, these are the most important symptoms, either asymptomatic or burning sensation in these area or pain. Okay, the most typical esophagoscopy, عارفون esophagoscopy يعني الاندوسكوبي. اوكي، من يدخل الكلينيشن للإيثوفاجوس الاندوسكوبي. This is referred to as esophagoscopy. Okay, the findings of this disease, what we can see: white mucosal plaques يعني patches. Okay, white patches, the same thrush, look like this thrush. Okay, white mucosal plaques resembling oral thrush in the distal third part of the esophagus with complications. This is just, it's considered to be acute phase. With chronicity and complications, this will be associated with bleeding, perforation. With chronicity, stenosis will be occurred, stenosis of the esophagus. And this is the big problem considered to the patients in the swallowing, of course. Okay, this is esophagoscopy. You can see this is the esophagus area, and you can see these just look like clouds. Okay, these are the white patches, I mean the thrush of the esophagus. Now, the second part of the stomach deep, okay, gastrointestinal candidiasis. Of course, the stomach is second only to the esophagus, but the disease can be jumped from the esophagus and easily metastasized to the gastric area, gastrointestinal area. Sometimes patients with acute leukemia or other hematological disorders maybe have numeral ulceration of the stomach, and this is due to this ulceration, patient due to chemotherapy, their stomach may be exposed to ulcer. Okay, and from the ulcer, because the microorganism is normally found in the GIT, maybe from the ulcer go inside from the stomach to the intestine, to the blood even, causing fungemia. This is the way how, that means candidiasis occurred in immune-compromised patients, leukemic patients, more than others, and this is due to the leukemia, due to the chemotherapy, not due to leukemia itself. Okay, because it's causing ulceration, hence the transferring of this microorganism through stomach ulcers to the intestine, to the blood, and going forming different manifestations. Of course, from the stomach maybe go to the duodenum and intestine. طبعا duodenum and intestine, it's lesser than the stomach and esophagus themselves. Now, the other entity of candidiasis is the peritonitis. Peritonitis is very important disease, which it's uncommon, considered it's uncommon, but it is common. يعني we found it's common. لأن عندي واحدة من طلابي PhD اشتغلت على البيريتونايتس. We isolate many high percentage of candida from peritonitis. Okay, it is considered to be uncommon. عندهم طبعا برا uncommon، بس احنا عندنا لأن احنا تعرفون not health care health care dealing not look like outside. Okay, therefore complication may be occurred, and particularly peritonitis occurred due to the contamination of the tools of the dialysis rather than other causes. Now, it is uncommon complications of chronic ambulatory peritoneal dialysis. You know the meaning of dialysis? طبعا من يسوون لهم دول غسل الكلى. عندنا two types of dialysis. عندنا peritoneal dialysis والهيمودياليسيس. الهيمودياليسيس بالبلد. اوكي؟ هذا يصير complication. وعندي طالبة ماستر بتشتغل على الهيمودياليسيس، بدنا نشوف طبعا هم عزت لحد الان الكانديدات. اوكي، but in the peritoneal dialysis, this is another method of dialysis. دائما this is the children mainly undergoing peritoneal dialysis rather than hemodialysis. يعني الهيمودياليسيس شويه مزعج للchildren. اوكي، فيستخدمون لهم peritoneal rather than. طبعا هسه ان شاء الله تاخذوه بالميديسن ان شاء الله whatever بالبيدياتريكس or medicine، تشوفون شلون الدياليسيس عندنا اكو two types and details. اوكي، in general peritoneal dialysis mainly those patients develop peritonitis due to contamination of the tools using for the peritoneal dialysis and causing candida infection. What are the symptoms that the patients develop? I mean, peritonitis. The symptoms are abdominal pain, tenderness, with or without nausea, vomiting, or low-grade fever. These are the main symptoms that the patient, develop when he having peritonitis. Now, the other entity of candidiasis is deep candidiasis. Candidiasis is the respiratory tract candidiasis. Okay, it may occur with or without, sometimes with or without, oropharyngeal or esophageal candidiasis. You remember oropharyngeal or esophageal candidiasis, sometimes with or without. Just respiratory or due to infection of the oral cavity, pharynx, esophagus, may be transferred to the respiratory tract, or sometimes without these complications, just alone respiratory complications. I mean symptoms. What are these symptoms? Hoarseness. Hoarseness, it means هذا شلون الصوت الأجش اللي يبح صوته من واحد يطبق صوته احنا نسميه بالعامي. Okay, hoarseness. The symptoms also, the other symptoms, sore throat, sometimes dysphagia. Okay, dysphagia, the patient make the يبلع. In endoscopy, what we can see بالendoscopy, in the endoscopy, bronchoscopy, upper respiratory tract, special إلها, we can see shallow ulceration or gray membrane. نحن نشوفها شوية grayish rather than whitish. Gray membrane which can be seen on the erythematous larynx. بالحنجرة اللي هي erythematous larynx نشوف gray or whitish sometimes membrane with ulceration. These are due to the colonization of Candida to the larynx. There is pulmonary candidiasis, mainly occurred but this is mainly can be discovered at autopsy rather than clinical entities. Maybe it's asymptomatic, but in autopsy من يشرحون البيشنت يعني maybe he died due to unknown source or cause. Okay, but they saw autopsy, they found his lung filled with colonized Candida because it's mainly asymptomatic. Now, urinary tract candidiasis. Urinary tract candidiasis is very, very important and most common entity of candidiasis. That means colonization of bladder, which is mainly occur due to complication of prolonged catheterization of bladder in those patients who receiving antibiotic. طبعا those catheterized, of course, they are admitted patients, hospitalized patients, bedridden patients. Okay, patients. Therefore, they, of course, under long course of antibiotic, maybe just prolonged catheterization without antibiotic. يعني the catheter itself colonized by Candida. Low hygienic care conditions or dealing with colonized by Candida causing the symptoms. وطبعا تزداد الdisaster when the patients receiving long course antibiotic. What are the other predisposing factor for urinary tract candidiasis? Is the bladder stone. Bladder stone, you know, it's foreign body, therefore it's considered to be predisposing factor for colonization of Candida to the bladder. DM patients also, DM patients many prone to develop, many patients of DM, they prone to develop urinary tract candidiasis. Why DM patients? Put in your mind, because you know insulin low concentration in those patients, therefore high sugar in their blood. Put in your mind, Candida is a sweetie, okay? It's prefer glucose, therefore it's colonize the bladder of those patients. Disease that lead to incomplete. Also, what are the other predisposing factors for urinary tract candidiasis? The diseases that leading to incomplete bladder emptying. You know, some patients suffering from, for example, bladder, يعني something wrong in their bladder nervous system. There's an incomplete bladder emptying. There is يعني the voiding of blood of urine is incomplete. Therefore, the residues of urine in their bladder easily to colonize by Candida in those patients.
دكتور العفو، البلادر ستون شلون نسوي الميكانيزم؟
بلادر ستون؟ لا مو البلادر ستون، حكيت على الدي ام. بلادر ستون is considered to be foreign body for colonize easy by Candida. قلت الدي ام ذول diabetic patients. DM patients with glucose or from high level of concentration of glucose in their bloodstream. Okay. فglycogen يعني that means it's glycogen high concentration. Candida is a sweetie يعني تحب الحلويات. yeah. فوين high concentration of glycogen flourishing of candida. yeah. لانه اليورين of those patients يصير sweety. مفهوم؟
تمام دكتورة، هي فهمت سمعت من البداية، شكرا.
عفوا. Now, what are the symptoms of the patient, of urinary tract candidiasis? Pyuria. What's the meaning of pyuria? Pyuria means pus in urea. Pus in urea. يعني هاي معروفة طبعا. It's truth. Pyuria in the presence of candidiuria. I mean candida in urine. These are the most important symptoms. A significant diagnostic tool when we take urine, examine under the microscope. Of course, we can see pus and candida in the blood. In the urine. That means the patient suffering from urinary tract candidiasis. Now, the other type of candidiasis is hematogenously disseminated candidiasis. That means presence of of candida in the bloodstream, which is also referred to as candidemia. Candidemia is very important disease. It's very risky disease. يعني كان البي اتش دي مالتي research على الكانديديميا الليكيميك patients. بتشي يعني ما احكي يعني بتشي المهم. الكانديديميا is very important disease. The most important factors, predisposing factors of patients to candidemia, those mainly hospitalized patients. They acquire the disease due to what? IV catheters, due to administration of antibacterial antibiotics, urinary catheters, surgical procedures, leukemia, etc. These are predisposing factors for what? For candidemia. That means candida in the blood stream. What are the symptoms of candida sepsis? Okay, that means candidemia, which look like bacterial sepsis. What are these symptoms? Fever, shock, DIC. DIC, it means disseminated intravascular coagulation. These are occurred in severe cases. Very important symptoms that the patients, from these symptoms, I can say that this patient developed candidemia. And these pictures, different pictures of this macule, erythematous macule. This is due to candida hematogenously. طبعا هنا later on we will know from hematogenous dissemination. And somebody asked me hematogenous dissemination, and so what? Sometimes from the bloodstream can incede the skin. يعني من blood infect the skin. This lesion comes from this patient suffering from candidemia, and the candida in blood incede his skin, causing this macule. Okay, this is ocular lesion. This also comes from hematogenous dissemination. Hematogenous, this is retina of the eye. That means patients with hematogenous dissemination. I mean candidemia. From the blood, the candida incede his eyeball. يعني from the blood, it's go to any organ can inceded by candida. Okay, these are on the details. This lesion also due to hematogenous dissemination from blood inceding skin. This is candida skin infection. Now the CNS candidiasis, central nervous system candidiasis. Candida meningitis. Candida meningitis is very important entity, which is mainly occurred in low birth weight neonates. Low birth weight neonates with candidemia. That means the patient who عنده candidemia, okay, neonates with candidemia, maybe occurred the disease, captured the disease from his mother, okay, and he have low birth weight and candidemia, he may develop meningitis, okay. And it's also, CNS candidiasis occurred in patients with hematological malignancies. Patients with hematological malignancies also may develop CNS candidiasis. Or those patients with complicated neurosurgery. And the complicated neurosurgery, or for neurosurgery, it's not easy surgeries, okay? But maybe due to operation surgery, maybe acquire the disease, start contamination from the tools to the bloodstream, causing the CNS manifestations. Or those patients with intracerebral prosthetic devices or shunts. سامعين بالشنطات يعني المشكله قلت لكم ما عندي في communication face to face. الانتراسيربرال بروستاتيك شانت هذه sometimes مثل الصونده يخلوها من الفنتريكم اللي عندهم هيدروسيفالي، يعني ما ادري انتم سامعين بهالمصطلحات لو لا. مرتضى سامعين بهالمصطلحات الدحشي هلا غريبة عليكم؟
ترى احنا سامعين مال الشنتله بالهارت يعني لا مال
لا 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 اكو ذول اللي عندهم هايدروسيفالي، هذا اللي راسهم كبير يصير، ما شايفين سامعين بالهايدروسيفالي؟ هذا
اي دكتور
اي هذا يصير عنده فلويد هوايه اكسسيف فلويد، فشو يسوي له؟ ياخذوا له شنط من البرين يعني بالبرين هو ياخذوها ويربطوها بالبريتونيوم، اوكي، فحتى تسحب الفلويدز. فهاي also يصير contamination also maybe develop CNS candidiasis. I just these are the predisposing factor for CNS candidiasis. Now, how we can differentiate? Okay, differential diagnosis. You know the meaning of differential diagnosis. That it's mean the how we can differentiate Candida from other mimicry diseases. Here, in case of superficial candidiasis, for example, in the buccal cavity candidiasis, this is Lycoplegia. Lycoplegia is a type of benign tumor of the buccal cavity, which is also formed white patch, look like the white patch of oral thrush. Lycoplegia. هسه تاخذوها ان شاء الله يمكن بالباثولوجي. Or squamous cell carcinoma, also another disease, maybe confused with the buccal cavity candidiasis. Of course, squamous cell carcinoma of the mouth, or maybe sometimes it's confused with the herpes simplex infection. Herpes simplex, it's a type of سامعين بالherpes simplex، هذا بالفيرولوجي ان شاء الله تاخذوه بالكورس الثاني اللي احنا نسميه بالعامي لطمه الحمى. طبعا هذه مو بس تطلع هنا بالماوث outside the skin surrounding the lips. Sometimes it's also occurred in the buccal cavity. Also it's confused with the oral thrush of Candida. Sometimes Candida infection coexist with other diseases. Coexist, that means it's maybe there is another disease associated or accompanied Candida, not alone. Okay, for example, in Candida esophagitis, it's associated with herpes simplex. It's associated also with another viral disease, cytomegalovirus. Also, this is confusable, give us confusable impact or impression of the disease. There is also concomitant نفس الشيء يعني coexisting, also concomitant يعني exist with other disease. In case of vaginal candidiasis, put in your mind بالاخص الجاينيكولوجيست اللي بالمستقبل ان شاء الله تتخصص جاينيكولوجي، الكانديدا يعني almost vulvovaginal infection due to Candida, mainly a concomitant with trichomoniasis. Trichomoniasis شنو هذا؟ طبعا هذا تاخذوه ايضا بالكورس الثاني. It's a parasitic disease. It is a parasitic disease. Sorry. So mainly there is concomitant infection of trichomoniasis. Trichomoniasis with Candida vulvovaginitis. Now, how we can diagnose Candida? Lab diagnosis. Of course, culture of this sample that we obtain. Of course, diagnosis depend on the site of infection. In case of skin, mucous membrane, the lesion can be diagnosed by microscopic findings. Of course, we can see the if you remember, I said Candida is yeasty form. We can see the yeast of Candida. Sometimes we can see what is called pseudohyphae. What is a pseudohyphae? If you remember in the first lecture, I said we have two types of fungus, moldiform and yeastiform. Moldiform, which is formed from hyphae. I said hyphae, it's tubular structures, okay? And the yeast is budding yeast structures, okay? Some yeast consists of what is called pseudohyphae. It is not truly or not truth hyphae. It comes from budding of yeast, bud, attached with each other, forming tubular-like structure, look like hyphae. It's referred to as pseudohyphae, not hyphae. Okay, this is the meaning of pseudohyphae. Pseudohyphae can be seen with the yeast in the microscopical diagnosis. This is in case of skin. In case of deep candidiasis, of course, the most sensitive and rapid method for the isolation of Candida, mainly from the blood, by a technique referred to as lysis centrifugation technique. طبعا lysis centrifugation technique is very professional technique. but it's unfortunate. Unfortunately, it's not available in Iraq. We have an alternative method, and here old-fashioned technique, blood culture method. Blood culture technique. This is can be used for the blood cultivation of blood sample. Smears can be used for CSF in case of CNS infection, meningitis, or vitreous fluid. Vitreous, you know, vitreous humor and aqueous humor سواء للعين السائل الزجاجي والسائل المائي. الفيتريوس هو السائل الزجاجي. Okay, in case of infection of the eye, joint fluid also can be by aspiration of the joint fluid if there is arthritis caused by candida. Peritoneal fluid in case of peritonitis also. طبعا هنا هي sorry, candida causing wide range of diseases. طبعا I just chose only few diseases. لو أعطيكم إياها يمكن الصبح ما نخلص. Many diseases كلش، لأنه سنة الارثرايتس ما قلت لكم. الفيترياس فلويد ما جبت لكم، يعني قلت لكم هو very wide range of symptoms. Okay, what is the suitable stain can be used for the staining of candida. طبعا gram stain can be used, but there is a special stain can be used for candida referred to as calcofluor white. This calcofluor, the calcofluor white, this name or this stain knocked in the first lecture when I said it is special stain staining the cell wall of the fungi. It is whitish stain, and it needs special microscopic immunofluorescence. It needs fluorescence, microscopy. Sometimes we have, in case of GIT infection, for example, gastric infection, gastritis, esophagitis, intestinal, we need biopsy here. طبعا endoscopy وناخد biopsy. This biopsy should be cultured also and use special technique for the diagnosis. Serological test is not helpful. Why serology is not helpful? Because candida, you know, it's normally found in our body. Therefore, the antibodies triggers normally cannot be used for the diagnosis, because it's maybe when you use antibody for diagnosis, maybe this is triggered for normal flora. How can I know it's normal or pathogenic? Therefore, it is not helpful in such cases. How can I treat candidiasis? Of course, candidiasis, each of which, each entity needs a special technique for treatment. In case of cutaneous candidiasis, we can use nystatin powder. Nystatin is very effective against candida. Nystatin powder is very helpful in diaper rash. You know, diaper rash, قلنا بالpampers rash, because this area is wetty. Okay, therefore we need a powder formula for the treatment. Nystatin powder very effective in diaper rash or in vitiligo in elderly patients. Okay, cream lotions with azole derivatives. Azoles just look like clotrimazole, iconazole, miconazole, ketoconazole. Also can be used creams or lotions, not ointment in such area. Cream or lotion also may be helpful in diaper rash or in vitiligo. Patients with chronic mucocutaneous candidiasis. You remember chronic mucocutaneous candidiasis, those patients with entities will عندهم autoimmune disease, recessive disease. Okay, this can be treated with oral ketoconazole or oral itraconazole when they develop oral thrush. In case of oropharyngeal candidiasis, in oropharyngeal candidiasis, we can use nystatin suspension or clotrimazole can be used systemically for immune compromised patients. Either nystatin suspension or clotrimazole suspension can be used, clotrimazole systemic for the immune compromised patients. All regimen should be continued for up to 2 weeks. It needs long periods of time, of treatment time. In case of esophageal candidiasis, fluconazole can be used once daily, also for 2 weeks, maybe more than this. It's effective. Vulvovaginal, of course, this is depend on the case of the patients. Vulvovaginal candidiasis. In such case, we can use suppositories. Suppositories, you know, hamil, yani, okay? So as all vaginal suppositories is very effective against candidiasis. Also, cream can be are more convenient, but I prefer when the patient suffering from vulvovaginal candidiasis will gynecologist بتعرف إن شاء الله يعرفونها الفاct. When the patient use azole suppositories, it's not alone. It should be supported by the cream. After azole suppositories, cream, nystatin, or whatever, or azole also, any one of the azoles can be support the suppositories. After finishing of the suppositories, واللي هي طبعا الميكانوزول that nowadays available أبو 400 ملغ، وراها يستخدمون الكريم. Myconazole also is very effective to eradicate vulvovaginal candidiasis. It's more effective than nystatin suppositories. In case of urinary tract candidiasis, amphotericin B, this is very important drug of choice. Usually it's the last drug of choice, but because urinary tract candidiasis may be so sophisticated, in particularly in DM patients, because they consider to be immunosuppressed patients, amphotericin B or fluconazole can be used for such entities. In case of peritonitis, amphotericin B also should be added to the dialysis. الدياليسيس اللي هو الواشنج يصير به السائل اللي يغسلون به الكدنيز البريتونيومز يعني اوكي peritoneum. This is the amphotericin B. In case of a candidemia, because it's so dangerous case, amphotericin B, then switch to fluconazole. Why we switched non-continuous? This needs long period of time. Amphotericin B is so expensive, costly drug, and it's also toxic. For if it's used for a long period of time, therefore it should be switched to fluconazole. Endocarditis, also amphotericin B, endocarditis, so also serious case. Amphotericin B IV, of course, with or without flucytosine, and also for ocular candidiasis, the same regimen of treatment for endocarditis, also IV amphotericin B with or without flucytosine. These are the regimen of treatment of different types of candidiasis. Okay, these are different pictures of oral thrush. This is also oral thrush. Another picture. This is cutaneous on the palm. طبعا put in your mind, cutaneous as nodule on the skin is very rare entity, but it's mainly occurred in immunocompromised. This patient is AIDS patient. Therefore, he developed cutaneous nodules on his palm. In particularly this area, it's very rarely to develop cutaneous forms. This is also another picture. This is another picture of diaper rash of the baby, and this is also this patient may be suffering from mucocutaneous candidiasis, maybe transfer the disease from his buccal cavity outside to the cutaneous area surrounding the mouth. And this is onychomycosis due to candida, which cannot be diagnosed or discriminated from tinea angium by dermatophytes. This is inguinal, this is gluteal crease, okay, due to diaper rash of a baby. Candidiasis, okay, that's it. Thank you very much for lab.